All right, so lymph drainage. It drains the interstitial fluid to the venous system. So as you can see here on the right side, the lymph system drainage is into the junction of the right jugular and subclavian veins, but it drains a very small, sorry about that, a very small area on that right side. So the right side of the head, the right side of the chest, and the right arm. The left lymph drainage is the thoracic duct into the left subclavian vein. So that's both of your legs, here, your abdomen, up this side, and then into, so your arm, the breast tissue, the breast and chest into that left subclavian vein. So the left side drains way more than the right side. So the lymphatic system, its functions, it fights disease, it returns proteins to the blood, filters that lymph, and then it transfers fats to the blood. So this again is showing you that you have iliac nodes, you have inguinal lymph nodes, you have nodes in the back of your legs, around your kneecaps. You have intestinal lymph nodes, you have lymph nodes in your elbows, you have lymph nodes in your axilla, you have lymph nodes that run up your thoracic spine, you have your thoracic duct, and then they dump into, like we said, the right side drains this right portion, and then the left side drains everything else into that left subclavian vein, and then the right side into the right subclavian vein. So a little quiz me here going on. So the primary function of white blood cells or leukocytes is to what? So A, B, or C? And it would be C. It defends the body. So the white blood cells and leukocytes defend the body against infection and disease. So the next one, what is the name of the major vein that is connected to the right atrium and brings deoxygenated blood from the upper body region back to the heart? And that one would be the superior vena cava. Next one. So where is the tricuspid valve located in the heart? And this is why you're going to have to know the flow of blood in the heart, where your valves are located. So between the right atrium and right ventricle, left atrium and left ventricle, right ventricle and pulmonary artery, or between the left ventricle and the aorta. And if you know where the tricuspid valve is, it is between the right atrium and the right ventricle. So what is the older term for the left atrioventricular valve? So keep in mind that there was another name, an older term for the atrioventricular valve, and that is the mitral valve. So which of the following is not a major branch of the aortic arch? So you're going to have to know what branches off of the aortic arch. Is it the left common carotid that branches off, the right common carotid, the left subclavian, or the brachiocephalic artery? So remember your arch, and you have 3 branches off of it. You need to know what 3 branches those are. And the one that is not is the right common carotid. So you have the left common, the left subclavian, and the brachiocephalic that branches off of the aortic arch. So the vertebral arteries are formed by and so now you have to know where your vertebral arteries are and which vein or artery, which artery comes up and then splits and forms those vertebral arteries. And that is your subclavian artery. So your subclavian forms the vertebral arteries. The S-shaped portion of the internal carotid artery. So S-shaped, is it the carotid flexure, the carotid siphon, carotid circumflex, or carotid body? And if you remember the S shape, that is the carotid siphon that is formed by that S shape. So which cerebral artery rests on the clivus of this sphenoid bone? So we talked about the clivus and which artery rests in there. Is it the internal carotid, the vertebral artery, anterior cerebral artery, or the basilar artery? And that would be the basilar artery rests on that clivus. So which of the following is not part of the arterial circle or the circle of Willis? So arterial circle or the circle of Willis. So that's why you need to know that circle of Willis, which ones are part of it and which ones aren't. Refer back to that PDF that I uploaded, and that's going to show you, give you a list of what's included in the circle of Willis. Is it the middle cerebral artery, anterior cerebral artery, anterior communicating artery, or the posterior cerebral artery? And the one that is not part of it is the middle cerebral artery. So make sure you review that circle of Willis so you know what makes up that circle of Willis. The internal and external jugular veins unite at the level of C7. So internal and external veins unite at the level of C7. Is that true or is that false? That is false. So make sure you go back and look at your internal and external jugular veins and see where they unite, what level they're at. So which of the following arteries is the first branch of the abdominal aorta? So now we're in the abdominal aorta, and we need to know which artery is the first branch. So the first branch, we've talked about superior mesenteric, renal artery, celiac artery, splenic artery. Which one branches off first? And if you remember, it's going to be the celiac artery is the first branch of the abdominal aorta. Okay, so make sure you know which one's first and then what order they go in, so you know what order they are descending that abdominal aorta and how they come off. Which of the following vessels does not help form the hepatic portal vein? So the hepatic portal vein, which ones form to create that hepatic portal vein, and then which ones do not help form? So is it the splenic vein, superior mesenteric vein, inferior mesenteric vein, or the hepatic vein? And if you remember that portopatic vein, it's going to be the portopatic vein does not form the hepatic portal vein. So your hepatic vein is not one of them. It's the splenic. So the splenic comes over, the superior and the inferior come up, and then they create that hepatic portal vein. So not the hepatic vein doesn't create that hepatic portal. Which of the following is not a function of the lymphatic system? So remember, we just talked about the function of the lymphatic system. Converts lipids into fatty acid and glycerol. Does it fight disease? Does it return proteins and other substances to the blood? Does it transfer fats from the intestine to the thoracic duct? And which one does it not do? It does not convert lipids into fatty acid and glycerol, okay? But it does do the other three. All right, so angiographic procedures. We'll go a little bit more here and then we'll break for another video. So angiography, radiographic imaging of vessels following injection of contrast media. Arteriography, imaging of blank would be arteries. Venography, imaging of blank veins. Angiocardiography, imaging of the heart. Lymphography, imaging of the lymph system and the lymph nodes. So Angiography Team, radiologist, which is an angiographer. You have the person that scrubs in, nurse or technologist who assists with sterile aspects of the procedure, maybe radiology nurse or a radiologic technologist. And a lot of times in this, it is both of those that scrub in. The nurse is usually there a lot of times just to monitor the patient, and then the radiologic technologist is assisting the radiologist, giving him his catheters and anything that he needs, and then also assist with imaging during the procedure. So pre-procedure patient care, medical history. So once again, always medical history. Explaining the procedure if you can to the patient. Checking the vital signs, which is something that you will have to do as a radiographer, but a lot of times there are nurses there, so they will monitor the vital signs and make sure that the vital signs are checked. Contrast media, that is something that you will have to get and monitor and make sure that you have the right contrast media. Your patient NPO and sedated, so you won't sedate them. That is either the radiology nurse or someone that can sedate that patient. The NPO, that's going to be a history either by you or the nurse. Skin prep, a lot of times, is you prepping the skin, setting everything up for the radiologist. The consent form is usually done by the nurse, but in that position, you can also do that consent form, and then assesses pulses bilaterally. Usually a nurse, but don't think that you won't have to do that as well. So sterile items ready for arterial puncture. So this is going to be you making sure that everything is laid out, everything is there for what the doctor wants. You're going to know what the radiologist wants. You'll be familiar with that, and then you'll be familiar with where to find them. So Seldinger Technique is a method of vessel catheterization, a 6-step process. So they're outlining it here where you're going to insertion of the compound needle, and then when you get a blood return into the lumen, you're going to remove the cannula. You're going to insert the guide wire, and then you're going to remove the needle because you have the wire in there now, and then you're going to thread the catheter over that that wire back into that lumen, and then that catheter can be advanced as far as you need it to be. So this is your wire. This plastic is just the holder for the wire. So that wire is going to be as long as you need it. So when you put that wire in, that wire is going to be threaded up through into the patient to where you need it, and then your catheter will slip over it, and that catheter follows that guide wire, and then you can pull that guide wire back when you get the catheter where you need it to be. And that's all going to be done by the radiologist. You just need to know what guide wire they need, what type of catheter that they need. So sterile supplies, so hemostats, your prep sponge antiseptic solution for cleaning the area, a scalpel blade if they need, if you set that up. Sometimes you will, sometimes they will. Syringe and needle for local anesthetic, basins and medicine cups if they're needed, sterile towels, band-aids for the very end, sterile image intensifier cover. So all of that stuff, usually they come in packages. You'll open them onto a sterile field and keep them sterile through the procedure. So angiographic catheters, there's several different catheters. When you do this as a rad tech, you will become familiar with all those catheters, which ones work for what, which one the doctor needs, when it's going to be used, how long it needs to be, all of that stuff. So there's a lot to learn about catheters if this is an area of study that you're going to want to go into. So the angiographic imaging equipment, general angiographic room with a biplane C-arm and digital imaging. So this is your C-arm. It's usually set up so this one can transverse and it can also go back and forth. You can see here, so side to side, but also along the length of the patient. You have this one here that should be stationary. It looks like it can swivel this way or this way. So this table can advance into it if need be. So these two can work in unison or they can work separate of one another. This one is a flat detector, direct digital C-arm. So the flat detector here, your imaging. So this one rotates on the top on the ceiling. So it rotates this way. And then this table can also advance this way and can also go back this way. So this C-arm, as it rotates around, it can be here, it can be at the top of the table, it can be here at the bottom of the patient, just depending on where you need it. So it's got a lot of movability. Just like the other one, it's just a single instead of a double. So digital subtraction angiography, DSA, digital subtracted carotid angiogram, a lateral view. So when you digital subtract, you take away everything else except for what you're seeing with the contrast material. So you can see the veins a whole lot better. And then you can see this S here, so that's a siphon. Okay, so you can see those a lot better when you use that digital subtraction. Digital subtraction process, your initial image. So you take the initial image, you mask the area that you want to see, and then with non-subtracted, your contrast filled vessels are here and with the bone. And if you digitally subtract it, then all you see are your contrast filled vessels. You eliminate the bone, so that makes it a whole lot easier to see. Automatic electromechanical injectors. So your automatic injectors, those are to maintain flow rates into your vessels, and then it includes a heating device to keep that that contrast material warm. It flows better, and it just reacts better within the patient as well. So sometimes they do have mechanical injectors, and you can set them up and you can start and stop them whenever needed. So abdominal aortic aneurysm, you can see this big aneurysm right here. Okay, so this is a 3D rational angiography. So they've done like a CT on a patient, or they've inserted contrast, and they're better able to visualize the aneurysm. And then they're showing here the same patient with a virtual stent. So it's just placing a virtual stent onto the patient, and then that way when you go in, you know what the stent has to look like, and then you can place that stent, and it just assists the surgeon and the radiologist and stuff as far as putting those stents in and determining if they do need a stent. So cerebral angiography, radiographic exam of the blood vessels of the brain, and you can see that this is without or with subtraction. So they subtracted all the bone away from it, so you see all the veins. So vascular stenosis or occlusions can be visualized. Aneurysms, you can see if there's any trauma. Arteriovenous malformations or any neoplastic disease, any cancers going on within the brain. So that's why a lot of those angiographies are done. So cerebral angiographic procedure, you can see here that they're using the dual head system, the C-arm, and then they're focusing on the brain there, and then they can tilt it on certain angles and certain degrees to better visualize all of those vessels within the brain. So the common carotid arteriogram, AP projection of the right common carotid. This again is with subtraction. Lateral projection of the common carotid, so AP projection and then lateral projection. And then arrow indicates the bifurcation is a common area of interest. So this bifurcation is a common area of interest of occlusion. So here you can't see that bifurcation very well, but in that lateral you can, and that's done just by moving that C-arm to get the image that is necessary. Your internal carotid arteriogram, a left internal carotid arteriogram, so PA left, and then a lateral left internal carotid arteriogram. So if you see this here, it's all laying over top of one another, but then when you, for a PA, so when you put them in the lateral, you can now see all of that separation of that siphon and that artery right there. So that's why you need the different images. The lateral, the PA, you're going to see much different imaging. You're going to see the way the veins lay much better. So just like we take an AP or PA and a lateral, you're going to do the same when you're dealing with arteriograms, venograms. So thoracic aortography, radiographic examination of the thoracic aorta. This is usually done via CT, but then they can also go up to the cath lab if they've got aneurysms, if they've got abnormalities, congenital or otherwise, vessel stenosis, embolus, or if they've had some kind of trauma and they need to go up and intervention needs to happen right away. So thoracic angiography, the thoracic aortogram, pulmonary arteriogram, and you can see this is the single arm right here, and it's mounted on the ceiling, so it can rotate this way, and they can visualize what they need to do. So you can do obliques, you can do PA, AP, laterals, and get different images of those angiograms to visualize what it is that you're looking at and what you're wanting to do. So thoracic angiography, right here you've got a 45-degree LAO thoracic aortogram, and that is just to separate, to keep this aorta from lying over top of one another. So you're going to do a 45 LAO. You're not going to put the patient in an LAO, you're going to put the C-arm in that LAO position. This is an AP pulmonary arteriogram with digital subtraction, DSA. So you can see all of that pulmonary arteries in those lungs. Make sure that everything is working, make sure that there's nothing blocked. And then with that subtraction, you see the tree-like appendages of the pulmonary arteries. So angiocardiography, cardiac catheterization, advanced catheter through the femoral artery and aorta into the left ventricle. So you come up from the femoral artery up the aorta and into the left ventricle, all under C-arm guided wires. Clinical indications can be coronary artery disease or angina, myocardial infarct, valvular disease, atypical chest pain, congenital heart anomaly, or other heart or aorta pathologies up the femoral artery, up the aorta, and into the heart to open the veins and do what needs to be done. So angiocardiography, left coronary artery, so you're seeing a left coronary artery and you're seeing a right coronary artery. And you can take APs, PAs, obliques, however you position your C-arm. And all of this, as far as angiocardiography, if it's something that you're going to specialize in, they train you on the job for it, and you learn what obliques you need to see, what vessels you need to see. And then your angiocardiography, your left ventricle analysis, and then automated coronary analysis. So you're analyzing the coronary arteries, you're analyzing the ventricles. It's all imaging and then calculations done on the images or via the imaging device that you have to see what needs to be done and what the next step is going forward for your patient. All right, I'm going to pause there. The next one is the abdominal angiography. So I'm going to post this one and then we'll start with the next one.